Hi folks, Dr. Ed Beyer here again. Today we're going to talk about autoimmune disease, and we're going to talk about one particular one that's quite common. They estimate over 700,000 people have it, and that's Crohn's disease. It's one of the inflammatory bowel disease, and it's an autoimmune disease. It's where your immune system, which should not attack what normally belongs in your body, is attacking the good bacteria in your gut. And it can skip around, it can hit one area, and that's what kind of differentiates it from ulcerative colitis, which is another autoimmune gut disease. Now, I want to mention that there's such a huge difference between how your traditional medical doctor is going to approach your Crohn's disease versus functional medicine. Now, what it is with traditional medicine, they're going to be giving you immunosuppressants, things like corticosteroids and things like Enbrel or Humira to try to suppress your whole immune system. Now, they may give you relief, but in the long run, it's not a really good idea, in my opinion, to squash your whole immune system, because you need your immune system to fight off cancer cells and other infections and things like that. The other thing that I see with a lot of my patients is they have surgery after surgery removing different diseased parts of the bowel. From a functional medicine point of view, we're looking at why your immune system is doing this. What is triggering your immune system? There are known environmental triggers to autoimmunity. Once we remove these, we see miracles. And these are things that your traditional medicine doesn't even look at. So you need to know, it's why I'm making this video, that you have options to your autoimmune disease. Now, the common triggers to Crohn's that I have seen personally: hidden gut infections. This amazes me that a lot of you who suffer from Crohn's or ulcerative colitis aren't ever checked for this. Or if you are, you did a simple stool test that isn't very effective and has a lot of false negatives. We use the most comprehensive stool test in the country by Great Plains Lab to identify these gut infections, and 99 times out of 100 we can remove them using botanicals without harming the good gut flora. Food sensitivities. Folks, you're living under a rock if you don't understand the fact that our food that we eat today is different than we ate 30, 40 years ago. And when we inherit our immune systems, we inherit it from generations in the past. And it's not used to all these genetically modified organisms that we're eating. And many of you have food sensitivities. So we test for this using a lab called Cyrix Labs, which is the most innovative lab for food sensitivities in the country. Once we identify what you should not be eating and you remove it from your diet, we see miracles. Another one is called small intestinal bacterial overgrowth. You're not supposed to have a lot of bacteria in your small intestine. And when your stomach doesn't produce enough acids and you get bloated and acid reflux, bacteria will overgrow in your small intestine, giving it good food for your immune system to attack, which is what is the underlying cause to Crohn's. And you should have large amounts of bacteria in your large intestine. Again, you need to be tested for this to understand the underlying causes, why you have this, and if you need a probiotic or a prebiotic, and if so, what type. The main point: multiple causes to autoimmune disease. These are huge ones in Crohn's, and there's many others. I hope that helps. I'm Dr. Ed Beyer. Have a great day.